Millions of people in the U.S. and around the world are suffering from a so-called loneliness pandemic. The number of cases have spiked since the isolation of the pandemic. Remote work has been convenient for some, but a byproduct of that has been loneliness. It's being described as a public health crisis, with 3 in 4 Americans saying they experience the emotion. The polling company Gallup estimates 44 million are experiencing significant loneliness. According to the latest surveys by Promo Leaf, more than a third of female workers struggle with that same problem. Men are even worse. They come in at almost half experiencing the same issue. For more on this loneliness pandemic, Julianne Holt-Lunstad joins us. She's a professor of psychology and neuroscience at BYU. Thanks very much for joining us on this topic. You know, when the pandemic first started, there was a lot of discussion that being in isolation ultimately was going to be bad, at least mentally and probably physically as well. So here we are a couple years later or 3 years later, and these statistics all come out. And I'm certainly not surprised. I don't think you are. I guess the question is, what's causing the U.S. Surgeon General to take this up a notch and make this a focus point right now?
You know, it's a great question because, of course, we know if we look at the trends across the past several decades, we saw increasing rates of isolation, people spending less time with family, less time with friends, less time in their communities, as well as trends of fewer people participating in social groups and participating in religion, among many other markers. Across these, we've seen how people are less socially connected, and these trends were occurring long before the pandemic, but the pandemic certainly exacerbated this. And we saw on a global scale how people were suffering. And so it's important because we know that simply getting back to normal won't be enough because the trends weren't looking good before.
You know, a lot of people would say that social media has had a fairly significant impact. So part one is when I see a lot of people on vacationing at beautiful places, I think to myself, well, I get a little jealous and I wish I was there too. But then you can't help but think there are probably negative thoughts that some people probably have. And then you think about politics. You know, we want people to agree with the way we feel about whatever our issue is in life, and when they don't, we kind of isolate ourselves away and we don't want to engage in it. How much does this social media phenomenon that we've seen take off over the past 10 years affect not only adults but also the youth?
Yeah, I mean, some of the things that you're describing, we see, you know, both online and offline, but online makes it far more accessible on a much larger scale. And so, of course, we're seeing some effects of that. But of course, there are also ways that it can bring people together across distances. And so it's a bit of a mixed bag. And so there are both harms as well as benefits, and so we really need to be careful about just lumping it all together.
So if we had a group of folks that came to you and says, help us, I've been working from home, or whatever it is you're doing, we feel lonely, we feel disengaged from the rest of society. How do you, number one, assess, because each person is going to be different. I don't want to blanket everybody as sort of the same issue, but most importantly, how do we address the issue in a positive way?
Yeah, so I mean, the first part is starting from a place of understanding where people are coming from and what the underlying issues might be. And so for many people, it's identifying what are the barriers to social connection. Humans are social beings, and we you know, desire and crave social connection. But unfortunately, we often face barriers, and those barriers might differ across different people. And so understanding what those are can help us then better tailor the kinds of approaches that might be more effective for one person than another person, because it really gets at really meeting the needs that they are facing.
if employees or people have questions about being lonely, who are they supposed to go to? Because, you know, society, I'm going to go on a limb here that this is not widely talked about. I mean, this is similar to depression in a lot of ways. Do you go to your HR? Do you tell your boss? Do you tell a close family member, or you reach out to friends for help?
You know, I think it's helpful to recognize that, of course, sometimes feeling lonely can feel like you're alone in it, and we need to recognize that many other people are feeling the same way, and especially just knowing the statistics, others may feel just like you, and so that might help reduce some of the shame and stigma around talking about it. But you may want to start with someone that you feel trusted and that you feel secure in that relationship. And so it could be a friend, a coworker, or it could be someone more at an institutional
Right.
level. It might even be someone outside that. But start with someone that you certainly trust.
Professor, this is obviously a growing and serious problem. I'm sure we'll have more attention to this later on. So really appreciate your analysis on this. Thank you.
I appreciate it. Thank you so much.